Senator Sanders.
Thank you, Mr. Chairman. Let me just start off with a question I think is on the minds of many people. This committee had a hearing on artificial intelligence, and I would throw in robotics. Let me start with you, Mr. Carrick, who are involved in manufacturing. Many of us want to see manufacturing grow in the United States, but from a worker's perspective, it ain't going to mean much if the work is done by robots. What impact do you think robotics is going to have on manufacturing and the ability of young people to get jobs, decent-paying jobs in manufacturing?
Yeah, 2 points. Thank you for the question, Ranking Member. I believe that robotics already play a significant role in manufacturing, and some of the best jobs in manufacturing are those that are operating those robots, are maintaining those robots, and are fixing them when they break. So robotics is a pretty significant element of manufacturing already. When you layer in AI, AI has also been a significant element of manufacturing through vision systems and machine learning. And as we look at Gen AI and how that intersects with manufacturing, when we talk to manufacturing executives, they believe that the best use case for Gen AI is actually in the technician workforce.
All right, you're looking at the positive aspect. I mean, there are other people who will say that the day may come when there'll be very few human beings in a factory. True?
I don't believe so.
Okay.
I believe that...
Okay, I want to ask other questions. I know there are differences of opinion on that. Let me ask Mr. Downey and Mr. Booker, what impact are you seeing in terms of job creation? Any concerns about AI or robotics? Mr. Booker, did you want to jump in, or Mr. Downey?
Yeah, look, and that's part of why the registered apprenticeship system works for us, is because we're in collaboration with our employers, right? So as technology happens, we have to embrace it. That being said, yeah, there's some fear over AI taking over humans in the workforce, and I'm here to represent, our members and our future members. And
you're for the humans, right?
I mean, every time I'm for the
All right, let me ask again the union guys. President Trump has canceled about 100,000 clean energy jobs, and that includes $7.5 billion for 223 clean energy projects. What does that mean to decent-paying jobs? Mr. Downey, do you want to?
Thank you. So those clean energy jobs, they're real hours for us. We've done tens of millions of hours due to the labor standards that were tied to the Inflation Reduction Act. So the shutting down of those projects were a direct hit to our members' learning wages.
Mr. Booker?
It's chaos and uncertainty. When you look at people who take the Revolution Wind example, they were on a barge in the middle of the ocean on Friday, get a stop work order. They've got to get back on shore, and they don't know when their next check's coming. So that uncertainty, that chaos, imagine not knowing when your next check's coming from when you thought you had a job. I've met members in Minnesota who were working on solar who had a 10-year plan that he was going to go from solar project to solar project, who had bought a house, who is raising his kids there, who doesn't know after he finishes this job if he's going to have his next job and where that's going to come from. So imagine the stress. Imagine you don't get your pension benefits, you don't get your health care. The stress that you have as an individual to provide for your family is overbearing.
Right. Ms. Laney, tell us, how extensive is the nursing crisis in this country?
It's massive, sir. The nursing crisis is everywhere. And it's not just nurses. Our hospitals and nursing homes are facing shortages of rad techs and all kinds of other things. And the nursing model for us—
By the way, if I can interject.
Yes, sir.
What will massive cuts in Medicaid mean to nursing homes?
If they don't have any money, they can't pay any people. That's as simple as I can make it. I don't track Medicaid payments very closely. I'm trying to—
But nursing homes are highly dependent on Medicaid payments, are they not?
As far as I understand, yes, sir.
Cut Medicaid payments, you're going to make it harder for nursing homes to survive.
Right.
But go on, talk about the nursing shortage in nursing homes, et cetera, and how do we solve it?
Right. I think we solve it by establishing scalable, competency-based apprenticeship programs that are directly tied to the skills that the person needs on the job. And then we make those programs more affordable. In nursing and teaching, both good examples, people are expected to go to work for free for a period of time, and that blocks out a lot of people from participating.
Help me out on this one. One of the problems we're having in Vermont, and I think it's national, we don't have enough nurse educators, people with graduate degrees to train nurses. Is that a problem you're addressing?
Yes, sir, it is, because you got to get them in as nurses before they can become nurse educators. Right. So we do look at that full pipeline.
And are you raising salaries for nursing educators so they'll stay in education rather than going into a hospital, for example?
It's actually the other way around. We don't raise salaries. It's up to the employers what they're going to pay, supply and demand. But one of the problems is there are so much higher paying jobs beyond the bedside.
Right.
That people are steadily pulled up out of that. And so employers are having to pay more for those people beside the bed. But as we say, you can't pay your way out of a skills gap. You have to train your way out of a skills gap. And so we look for those opportunities to create options for people to be able to afford to go into those jobs.
Okay, thanks. Thank you all very much.